with monitoring the chat box. So welcome everyone. Thank you so much for joining today. This is a webinar, informational webinar about our National Learning Collaborative that is going to start up in October of 2022. And so the plan for today, let me just go to the next slide here. I'm going to give you some background and history on our organization. Then I'll talk about how the Learning Collaborative works. We have a couple examples. And then I just have one slide on what's next for us. I did put Q&A at the end, but I'm also going to pause at each of these points. So, please raise your hand, use the chat box, whatever way works for you to ask questions. We're pretty informal here. Brenda and Kim are going to help me monitor that. So before I go too far, though, just a reminder to please stay muted. There's a decent amount of us on here, and so we want to make sure that we don't have too many background noise. And I'd also like to start by just doing some introductions. I'm Stephanie Norling. I am the Executive Director of Communities of Excellence 2026. I've been in this role since 2014. So really love working for this organization. Brenda, would you go next?
Hi, everybody. I finally unmuted. I'm Brenda Grant. I was with the Kanawha Coalition for Community Health Improvement in Charleston, West Virginia. We were in the first cohort, and it's just been a great journey for them, and I'm serving as faculty now.
All right, and Kim.
Hello, everyone. My name is Kim Halfhill from Excelsior Springs with the world famous Wabash Barbecue. So I was part of the original Excelsior Springs group that has gone through the Communities of Excellence journey. We are an alumni community now, and I also serve as a faculty member and community mentor for Communities of Excellence.
All right, thank you. Thanks to Brenda and Kim. They both joined me today to help me out. So at any point you both feel like you want to add something, please do. This hopefully is more informal than most webinars. All right, so let me get started with some background and history on our organization. This is our foundation statement. We've had this from the beginning, and it really helps kind of guide our work and guide why we're here. And that is that for America to sustain its vitality, promote opportunity, and create a more equitable society during its second 250 years of existence, we must improve the performance of communities and the people who lead and live in them. And if you've wondered why the 2026 exists after our name, Communities of Excellence, that is the 250th year of our country's founding. And so that is really a stake in the ground for us and sort of a guidepost to what we're working towards. These are new statements that we've recently developed, but I think they really encompass why we exist and where we're headed with this organization. And so our core purpose is to ensure that every person in America has the opportunity to live their best life in communities that are thriving. And our envisioned future, communities that adopt the Baldrige-based Communities of Excellence framework are recognized as the top performing in the nation and are catalysts for our country to again lead the world in educational attainment, economic prosperity, health and wellness, and quality of life. So again, that just gives you a little bit of hopefully a sense of who we are, what our values are, what's important to us, and why we're doing this work. And speaking of why, kind of where this came about, we were founded by two healthcare CEOs who, under their leadership, received the National Baldrige Quality Award in the 2000s for healthcare. And after they retired, this really just started out as kind of a backyard conversation with them and others who were discussing essentially their concerns about a lot of these, high top indicators in our country, and that they really just aren't headed the right direction. Thinking about, health statistics, educational attainment, all these things that I just talked about. And they sort of, despite the fact that there's so much done in this country to address our challenges, there's no shortage of efforts, no shortage of amazing people working on this, of tools, of data. I think it's Kim who says, what is it, an ocean of data and not a drop to drink?
Yes, data everywhere, but not a drop to drink.
Yeah, exactly. And so there's so much going on. And the idea was, could we take this Baldrige framework that they had both used to transform their communities that really helps take a systems view of your organization and what you're doing and align your efforts and come together? And could we apply that to a community setting to basically help sort of the same thing, to put a framework to this work all these incredible people do, and make sure that we're getting the results that we want out of that. And so really the issue that we identified, and one of the reasons that we think the framework is so important, is that we know that there is no systematic approach familiar to and used by all entities within communities that ensures federal, state, local, and private sector efforts are aligned and integrated to maximize their benefit and impact. So really that's what I think the value add one of the value adds of the Communities of Excellence framework is it really helps bring all these efforts together, bring the hard work together, unite leadership under common goals, common language, common data, and really focus on the results that we need. So that original hypothesis that I talked about, taking the Baldrige framework and adapting it to communities, we started with this hypothesis that a systems framework that we know can drive performance excellence in companies and organizations, the Baldrige framework, can be modified to achieve performance excellence in communities to benefit the health and well-being of residents. So we're talking about a framework within an organization and then basically applying it to a bunch of organizations and sectors across a community. Before I get too far, I know some of you are part of the Baldrige community, familiar with it, but many of you it's probably new to. So I just want to give a little bit of history on it. I won't spend too much time, I promise. But the program was founded in 1987, and it's a public-private partnership. It's housed in NIST in the Department of Commerce. And its purpose was to improve U.S. quality, productivity, and competitiveness. Originally, it started in the manufacturing sector in response to basically being outcompeted by other countries in the 80s in manufacturing. Today, it's used by organizations across the country of all sizes. I actually think one of the smallest winners was a small barbecue store in Texas of just a few people. And one of the largest was, we're just keeping a barbecue theme today. One of the largest was, I think, thousands of employees. There's been many big Boeing and others that have used this framework as well. National awards are given out at the presidential level every year for organizations that meet a certain level of criteria. And there are 30 state and regional programs across the country that also use this framework, giving out over 2,000 awards a year. And it is really the international standard. It's been adapted or adopted by over 80 programs around the world. So pretty powerful. Again, the purpose, improve quality, productivity, and competitiveness. But then also the program's purpose is to establish a nationally recognized standard of organizational and soon community excellence and quality performance. And then to establish role models of that standard through the Malcolm Baldrige National Quality Award. One of the values of Baldrige is really the sharing of best practices across organizations, and even across sectors, that really helps everyone kind of improve their performance. And I just pulled some examples of websites of some organizations that have received the award. And these are really powerful to me. The top is, I believe this is Alamo College, so an educational institution, South Central Foundation, which serves as a healthcare organization that serves Native Alaskans in the southern part of Alaska, Charter School of San Diego, which serves at-risk youth in San Diego, and C.O.R.E, which is an organ donor and transplant organization in Pennsylvania. So not just businesses anymore, all different sectors, and just does amazing work for their customers, in these cases, students and others. So what it is a set of questions. It is a validated set of questions updated every 2 years with kind of the leading edge practices going on in organizational performance. It can be applied to any organization, and really, as I said, helps align plans, processes, actions, results to support key organization-wide goals, helps you evaluate performance and improve. That's really the goal of this framework, and really encourages communication and knowledge sharing. On the left is kind of a visual display of the 7 categories of the framework, measurement really being sort of the foundation of it, and then underlying everything is a set of core values and concepts. So there's different questions across these 7 categories. The questions themselves do not tell you how to run your organization, but they sort of get at, if you can't answer the question, well, maybe there's something I need to be doing there. And so I think that lack of prescription is really powerful in this framework because it's really about what your organization needs. So with that, reimagining that in a community then takes on kind of a new life. We know that Baldrige, like I said, a systems framework. In communities, we know that our educational attainment, our economic vitality, health status, safety are all inextricably interwoven like a complex system. However, community leadership is not hierarchical, not like an organization. It requires a commitment among leaders across sectors, across generations, formal leaders, informal leaders, resident leaders. It really is a holistic collection of individuals in a community and a backbone organization to support them, which I'll talk about a little bit more in a bit. So what that means then, when you look at how this is applied in a community, is that the fundamentals stay. It is applicable to any community. And you can see that when I show you the map of who's adopted this framework across the country. It unites leaders around a common language. And that's really important when you think about different sectors. So we speak different languages. We refer to things differently. We organize differently. And so developing a common language across your community is one of the really key first steps to identifying common goals and bringing people together and mobilizing resources and identifying new measures and all of these things that are so critical. So similarly, in an organization, this really helps align the different efforts going on across your community, identifying key prioritized goals in your community that you can all come together and work on, be able to analyze data, make decisions with that data, as well as promoting a culture of quality, of improvement, of evidence-based decision-making, and underlying it, of course, is a community culture and set of core values. Some of the key differences here, I've talked a little bit about leadership, really important section here. Community strategy, we're not talking about the individual strategies of organizations, but the community-wide strategy that you've come together to develop. Instead of customers, we're really thinking about residents and other customers such as tourists, maybe businesses that exist in the community, commuters. I mean, there could be a lot of different other customers. And instead of a workforce, we're really thinking about people resources, which could also be customers, but those people that are doing the work in your community. Something else I just want to emphasize here is that in no way does this ask organizations to stop doing what they're doing in terms of their own strategies or change what they're doing, but really is just a way to, in addition, help identify those key priorities and just mobilizes more resources towards them. So just to kind of sum this up, the way I sort of like to think about this is that wherever you live, however your community operates, there is a system in place for how things get done around here. To create the results we want, we really have to understand how that system is getting the results it gets now. And to achieve different results, the system has to change. It sounds pretty straightforward, but as we all know, if it were easy, it would be done by now. But that's really what we're after here is systems change within the community and how you do work. And this requires leadership at every level in your community. So let me just pause there. And first, I'm just going to ask Brenda and welcome Crystal. I will add Crystal here as well. And Kim and Crystal, if there's anything that you would like to add. To wrap up that pretty well, so sort of a background of the organization.
Good job. Good job. I think, just to emphasize what Stephanie said, you really do, through this process, become a convener of people and with a real focus on coordinating resources to get rid of all the duplication of effort and wasted dollars in community. So, the questions that are asked that you answer through this process really do help your community become much more effective. And the focus on results has been absolutely critical.
Thanks, Brenda. All right, is there any questions from any of you before I get into how the National Learning Collaborative works? All right. And if you come up with questions, you can put them in the chat box. You can save them for the end, whatever works for you. All righty. So next, I'm going to talk a little bit about how we support communities to adopt this framework, and that's through our National Learning Collaborative. But before I get to that, I just want to add one more thing here, and it's a question we get a lot, is what do you mean by community? There's obviously a lot of ways you could define that. And for our purposes, we really talk about two things. One is geography, and the other is identity. And so these are kind of three examples that I would share. The first on the left, this is San Diego South region. They are part of the County of San Diego. It has 6 supervisory districts, and there's about 6 cities within that region, and quite a large unincorporated area. And so when we were initially working with Health and Human Services Agency, who's the backbone for this group, they thought, with a 500,000 person region, though that's too big, let's just start in on 1 or 2 cities. And they had looked at National City and Chula Vista. And as they got going, they realized that we saw very clearly that many of the organizations that work in that region really work across the whole region. They identify themselves as South Bay San Diego, not National City necessarily or Chula Vista. And they really had a strong identity as South Asian. So that's why we then decided that we would adopt this across the entire region of 500,000. And that's proven to be a really good choice. In the next example here, you have Northwest Missouri. There's 18 counties. And this one I think is a really interesting one because there are some things that they do at a regional level, some things that are done at a local level in these smaller towns. So for instance, you see Brookfield and Marceline there. They are what you'd consider a regional trade center. They have a population of about 10,000 or more, I think. Crystal's going to correct me on all of this. But so Brookfield and Marceline, there are some things that they can do at that local level, but a lot of the major issues that this region faces in terms of population loss and economic opportunity really also need to be addressed at a larger regional level. So you see it's the 18 counties of Northwest Missouri. There's also initiatives within that. And then on the right is West Kendall, Florida. It's an unincorporated part of Miami-Dade County. It doesn't have its own mayor, city council. And so its service region, its community is the service region of the West Kendall Baptist Hospital. It covers a few zip codes, and that is the backbone organization for their effort. Really the facilitators, the kind of entity that's driving this within that community. And so that just made sense in terms of what they meant by community there. All right, so with that, before we get started, I just wanted to give you a couple of things to think about as we go through this. Critical success factors for getting started. This is the other thing that a lot of people ask about, and there is no one path to starting this journey, just like there's no one type of community or type of leaders, or that's part of what's great about being non-prescriptive, but that at the same time, sometimes people just want you to tell them how do you do this. But so here's 4 things to think about. First, start with your why. So there's always a sense of urgency. You need a reason for people to come together, right? In Excelsior Springs, they had identified a pretty shocking disparity in quality of life between their zip code and the next. Similarly, in Toledo, it's quite shocking. In Northwest Missouri, there's a visible urgency in terms of loss of population and other things. So there is always something that will rally your community together that's sort of greater than these individual organizations and challenges. Next, identify who to involve, and we'll talk more about that. I think in a minute here. Agree on what system to use. So for us, we're basically saying the Communities of Excellence framework is that systems framework that can help you transform and get this work done. And then identify the process for how you'll do it. And that's really what the questions in the framework are asking you, right? How do you lead? How do you make decisions? How do you develop a strategy together? And there's no one way you have to do it. You might find a tool that really works for you. Another community might be using a different tool, like collective impact or something that works for them. And so it's really about asking the right questions for your community to identify the right answers that work for them. So this is sort of the why, who, what, and how is really, I guess, one of the first formulas I think about for getting started. And then in terms of getting started and who to involve, we suggest that this is kind of what you think about. So first, you need commitments from members of key sectors. We talk about the community as a system. It's really important to think holistically and get representation across your community system. And there's no required sectors here, but think about health, education, business, social services, safety, or many of our communities that start working with us will have a pre-existing coalition that has representation from at least 1 or 2 sectors already involved. And we'll view this as an opportunity to bring more people into that pre-existing. So that's kind of one of the first starts. You want to have an identified backbone organization and staff within that will provide the ongoing support to sustain this effort and to serve as the key contact. And so if you think about what a backbone organization can be, any organization and community. We have the libraries, state division of libraries, community foundations, health, hospitals, public health departments. I mean, there's no organization that can't be a backbone organization, but they have to be willing to basically keep things running, be sort of the command center, the operations behind this, but be a neutral party and be trusted by the community. The community has to trust that this backbone organization is doing this on behalf of the community and not strictly for their own interests. So that's really, really important. We also have a number of cities, city governments, county that take on this role as well. There's so plenty of opportunities there, but critical to have at least one backbone organization. You can have multiple as long as you're clear on the roles and responsibilities and staffing there. And then next year, just understand the time commitment. There is a significant time commitment into this. If you really want to change things, you have to put the work into it. You have to be willing to look beyond sectors, beyond silos, past just the idea of projects and activities, and really be thinking about systems and processes and sustainability of this work. And then recognition that this is a forever journey of continuous improvement. This isn't a project. This is the way that you run your community, the way things are done is changing that, changing that towards a culture of excellence and high performance. How am I doing on time? So let me actually just pause there in terms of kind of getting started on what I've laid out. Is there any questions about that or any comments from our participants? Okay, great. I'll keep going. So this is the model that we use in terms of the National Learning Collaborative. It's a 3-year effort. And then we also have an alumni program after the 3 years so that you always have an opportunity for support from communities of excellence and from our amazing group of volunteers and staff and mentors and community after that. The way that we sort of envision this is that year 1 is really about learning. You will identify a group of leaders that will participate in our online sessions. It doesn't have to be every single person in your group, but you need a diverse group of people that are attending these sessions and really learning and taking part in them. And in the first year, it's about learning, familiarizing yourself with the framework and learning about your community. Who's involved, what's important to your community, what its challenges are, what's its identity, all these questions there's called the community profile. And that really understands kind of what is your community right now and where do you want to go? And so as you're doing that, you're building the common language I talked about, you're sort of building a community culture, you're bringing people in, you're teaching. So it's a lot of work in the first year. And it's a lot of really foundational work. And oftentimes people feel like, maybe they're not making enough progress or, we just want to go out there and do something. And you can certainly go out and do things, but this first year is really about learning. In the second year, we then take all that work you've done in the first year, identifying priorities and really key challenges in your community. In the second year, we help you to develop your strategy and action plan and then get started really taking action on those priorities that you develop, as well as continuing to build and strengthen your community leadership system and how you work together as leaders and how you kind of make decisions, embed sustainability and all ethics and all these really important things that will help your leadership group kind of sustain and continue on. And then in the third year, we bring in those other key components around, making sure that you have listening to your residents and resident satisfaction, engaging the right people, measuring, designing processes and community operations, and basically setting you up to continue this work, hopefully in, perpetuity. I was trying to think of what that word was. So again, 3 years, identifying, prioritizing, planning and implementing, and then analyzing and accelerating, if I were going to wrap it up in a nutshell. And while this is something that we kind of will share with people initially getting involved, obviously, when you're working with community leaders, you use a different language in your own community, and each community really develops what that language is that they're going to use. But we help now, and we've been continuing to add new tools and kind of playbooks and things that can help you translate that into your own community. So on the left is kind of an example of something we developed recently, our journey roadmap. And it helps you kind of think about what this journey is and how you would apply it to your own community, kind of starting with knowing your current story, which I talked about, envisioning a future story, and taking action on a new story. And in our Learning Collaborative, we really help walk through those steps to get what your goals. In the first year, the activities will include a kickoff conference. This year it's going to be in San Diego, California in October. We have twice monthly online sessions with cohorts of up to 6 communities at a time. So if you were to join, there would be up to 6 communities involved. We like to keep them small so that you can have good discussion, but also have enough communities so that you can share and learn from each other. You'll get a mentor that's just assigned to your community to really help coach you in this work. We have expert reviews of progress throughout the year, quarterly skill building sessions where we have special topics that maybe don't quite make it into the curriculum, and then participation in our annual assessment and recognition program, as well as some pre-collaborative leadership team building sessions. So quite a bit of stuff in the first year that we provide to you. And this is just, speaking of the assessment and recognition program, remember I talked about the Baldrige National Quality Award winners. We have our own sort of smaller version of that, where communities will respond to the questions and they will get a feedback report that kind of shows their strengths, their opportunities for improvement. And we also do some nice award recognitions. So we have some just some fun pictures here. The one on the bottom left, that's San Diego South Region. And what I love is that they made a copy of their award and gave it to every partner organization in the South region that was taking place. And so that's just their local picture of that. So pretty fun. And then just in case you're sort of wondering what that looks like, I just wanted to quickly share this. This is an example of San Diego North regions. They responded to the questions, they got a feedback report, and then as a leadership team, they all read that report and kind of identified their top key priorities to address. And so they found these 3 key gaps here that the team agreed, okay, we can't fix everything at once, we can't do everything at once. And this is just in their first year. They identified these 3 key gaps and develop leads and develop action plans to really take to just make what they're doing stronger. So data, business sector engagement, and voice of the resident, capturing that were sort of 3 of their key gaps that were identified in the first year. So hopefully this kind of brings that to life a little bit more for you. This is just the key dates. I'm not going to go into too much detail because it's basically what I shared, but these will be, I'll send this afterwards. And if I were really to sum up what we're trying to help you do here, this is one of my favorite graphics. This is also part of the Baldrige programs, but we've changed it a little bit. But I think most communities, when you sort of think about the work going on in your community, you're probably somewhere on the left here, maybe either reactive or maybe you're proactive. You're all sort of working somewhat towards the same goals, but it's all a little bit messy. Maybe sometimes things are going in different directions. But really what we're after is getting over here on the right to aligned and to integrated. And that's where I think you could see just how powerful it could be if communities and leaders and organizations were coming together to address the things that we really need to address in communities and do it in the right way, in an equitable way. So I just really like this graphic. All right, before we get into examples, I'm going to pause again. Any questions? Any comments from our lovely panel?
So Stephanie, we have a question in the chat box. Any examples where community's excellence was successfully adopted when initially only one low-level person spoke Baldrige and communities of excellence?
Interesting question.
Yeah, it is.
You want to answer that?
I was just going to comment and say that I think in a number of our communities, they began without any Baldrige experts in the room whatsoever. And so in ours is an example of that. We had one person who knew a little bit about Baldrige, but I think that's not uncommon in communities to begin without any real Baldrige expertise. And I think that's really where kind of that patience and perseverance in year 1 comes in as you're all learning that language together.
Great. Good answer, Kim. Thank you. I appreciate that. Did that answer the question? Okay. Any other questions?
I think there's one more in the chat It says, are there data not only on greater effectiveness, but also greater efficiency?
I like that question. Not really hard data, like probably what you're asking about. I think there's anecdotal stories, and COVID is probably, the experience during COVID is probably some of the most powerful stories of that, where our community excellence groups, that's kind of what we call that core team, often were able to mobilize more quickly, communicate because they already had those communication channels in place, and get things done more quickly, which I would say is probably part of efficiency, than they would have if they hadn't have had that communities of excellence work going on. Would anyone like to add to that, Kim or Crystal or Brenda?
I might just add that community development, community collaboration work, community performance excellence work isn't necessarily all about efficiency at the beginning, right? Because communities are complex, but the goal is to get to sustained efficiency and effectiveness. And so sometimes it has to slow down a little bit at the beginning to let more people in, which doesn't always feel very efficient at the beginning, but I promise you that as you move forward through this work and that common language is established and there's a system in place for how you lead and how you listen and how you work together, things start to click and they do become more efficient as you get to that aligned and integrated phase.
That's a wonderful answer, Crystal. And actually, Crystal, since we did introductions in the meeting, would you mind just introduce yourself briefly?
Sure. Sorry, I was hopping up another call. My name is Crystal Golnick, and I work with the Maximize Northwest Missouri group, which is part of the Community Foundation of Northwest Missouri here. And I also help out Stephanie on the faculty and as a member, a mentor as well, with communications. So multiple hats.
Thanks, Crystal. And I would add, there's one other person on our very small staff here who couldn't make it today, but Manuel Castaneda, who is a part of the San Diego South region community. He's also a mentor, a part of our faculty, and works with me helping design curriculum and other important tasks. So that's our small staff. All right, so I'm going to do some examples. I'm going to put Kim and Crystal on the spot here as well. So surprise. Just quickly go through these. I won't spend too much time, but I did want to just, we've talked about this sort of conceptually, but I want you guys to sort of get a little sense of what this looks like in a community. These are this is a map of all the communities that have adopted this framework and are currently a part of either our National Learning Collaborative or our alumni program. So we've had 5 cohorts go through, and what we're looking for here to identify is our 6th cohort, which would start in October, which hopefully some of you are considering participating in. As you can see, our smallest community, McCook, Nebraska, 7,500 people. Our largest, St. Louis Metro Core, I believe that's our largest, is over 1 million people. And then everything in between. We have Louisiana. That's a very, they're ambitious, kind of tackling this from a whole state perspective, as is Delaware, attacking this from sort of a state perspective. But, there's some of the backbone organizations here facilitating this. We have a lot of healthcare organizations, public health, cities, let's see, what else is here? The city government, community foundations, Health and Human Services Agency. There's a lot as a community foundation. So hopefully this just gives you a little sense of the variety of communities that are involved. And what I love is you can see the colors or the cohorts that they're in. And so each cohort will have a whole variety of communities. And I just think that's so great. It gives, I think, a lot of just power to the sharing that goes on between communities. And oftentimes you might not think you have something in common. If you're San Diego County, you may think you didn't have anything in common with Northwest Missouri, but you guys can actually learn a lot from each other. And it's really fun when that happens. Anyway, so the first example here I want to share was Excelsior Springs. And Kim, do you want to, I didn't really set them up for this, but I just want to, if you just take a couple minutes to sort of talk about your journey, who you've involved, and kind of how you approach this, would you mind?
You want me to talk about barbecue? Is that what you said? No.
Yeah,
Okay,
barbecue.
We've already talked about barbecue today. So sure. So we were part of the very first Communities of Excellence Learning Collaborative. And one of the things that was really important to us in establishing our local Communities Excellence Group, our backbone organization is the City of Excelsior Springs. We kind of function out of the city manager's office, and she is a huge champion and cheerleader of this process. And one of the things that she really wanted and dreamed of for our community when she was relatively new in her role is a table where folks could all come together, right? So again, kind of this idea of aligning and integrating community resources to reduce redundancy and waste across the community, to really give some strength and some power to our programs, and really just, an opportunity for the sharing and exchange of ideas. So as you kind of look at some of the graphics that you see on the screen, one of the things that you'll notice is that there is a lot of cross-sector collaboration across our priorities. Our priorities are working in health and wellness, housing, economic vitality, and community engagement, all towards, pointing towards that big goal of increasing lifespan and quality of life in our community. And so, you may see some unexpected partners sitting next to one another at some of these tables. So I think our housing task force is a great example of that. We have folks from the housing authority sitting right next to our real estate agents, sitting next to social services and a mortgage broker and our school district social worker. So folks who are all viewing, the challenges of housing through a very different lens, but it's so important that they're having that conversation together and really working on that priority together, setting goals together to make sure, again, that we're all working in one direction and not creating unintended consequences for some of our community partners. So that's been really powerful in our community. One of the things that I think is just a kind of a great anecdotal testament to that, if you will, is we've recently had a request from some of our task force leaders to create an informal opportunity for people just together who serve on the task forces, hear about what's going on in the other task forces, what's going on in their organizations, and just share resources and ideas. And we're going to start hosting like a monthly, we're going to call it the Monday meetup, just an informal time for people to drop in and have lunch together. So we sent out the first invitation for that. And our hope was that, maybe we would get like 5 or 6 people at a time who would gather. Schedules are busy. And we've had about 20 folks RSVP for the first one next week so far. So I think that just speaks to the power of having a convener in your community to foster these conversations. So it's been a great experience for us.
Thank you, Kim. All right, that was very well said. So that's Excelsior Springs, and we recently had our spring conference this past April in Excelsior Springs with our amazing hosts from Thrive Excelsior, and it was just wonderful, and we did have wonderful barbecue. So the next community I want to talk about is Northwest Missouri, and we are lucky enough to have Crystal here. So Crystal, would you mind just taking a moment?
Sure, I'll keep this really brief. So we are covering an entire region of 18 counties that are primarily rural. We only have one county that is considered metropolitan because it has roughly 200,000 people. So we're talking about small communities, and I know at the Communities of Excellence level, I think Stephanie mentioned that McCook, Nebraska at 7,500 was the smallest, but indirectly through the fact that we're involved, we have a lot of communities that are, less than even 1,500 people involved. And so our whole goal is, quite frankly, to turn around our population loss. It's a really small map there, but you can kind of see that where all that red and orange is up in the northwest corner of our state. Those are indicators of where we're losing population, and not only currently still losing population just in this last decade, but over the last century, quite frankly. It's been a slow drain, if you will. And so that impacts our community in a lot of different ways. And when I say our community, I mean our region. And so we're trying to figure out is how do we engage all of the different leaders from all of the different sectors to take that sort of level of diversity, as well as all of the different municipalities and counties, to come together around that shared table that Kim was talking about. And so that's what we're after, and we're starting. It's a little slower process for us simply because there's so many different people involved. I know that When I visit with Manuel, talking about his experience in San Diego, they've got like hundreds of partners around their table or involved in some way, shape, or form in different parts of their process. We're going to be in the same situation. It's just a little different because we can't gather around one specific community initiative. So it's been really interesting, but we're holding discovery groups to listen to our residents and other customers and really understand what our story is and what perceptions are, what everyone's mental mindset is, and really what is our culture. And then we're also involving people and engaging them in envisioning a new story for the region. What would it look like if we could keep a few of our young people here, or at least a few more of them, or attract them back after they've gone out to do what they want to do in their early decades of life, right, before they settle down and have families. How can we attract people back and keep people in the region to make sure that we're capturing our innovative talent and the genius that we have here, so that it benefits here and it really starts to take advantage of that circular economy, to help uplift all of the different parts of our community: health, economy, education, and quality of life. And then also really what we kind of found through asking all of the questions and the framework that we're learning through Communities of Excellence is that we need to basically start with increasing the number of leaders we have, as well as their capability. So introduce what systems thinking is all about to them, introduce to them what it can look like if we work together to maximize our potential. And it's been really fun. We've had a lot of success so far. Even though we're several years into our journey, we're still in early phases. So this is definitely a long view sort of effort, and it takes time, but it's worth all the time for sure as we make progress.
Great. Thank you, Crystal.
Mm-hmm.
All right. The next example here, I'll just talk about briefly. This is Toledo, Ohio. And this is actually a graphic they developed really early on in their journey. And I just love it. I think it does such a nice job of kind of laying out what they're doing and where they're headed with it and why they took on this work. Currently, they've, after this sort of initial focus, they developed some very ambitious goals around a number of areas: health and wellness, employment, education, and others. And what they've done is they have kind of short-term goals and long-term goals. And for instance, in education, they had a long-term goal of, I want to say it was increasing the literacy rate. I can't remember. It was very ambitious. And then a short-term goal of universal pre-K, which they succeeded in actually, I think, their second year. So it was pretty amazing. But again, just a really good example of kind of a micropolitan or a smaller metropolitan area that brought leaders together. The backbone organization here is ProMedica Health System, which is the largest employer in Toledo. And so for Toledo, certainly improving quality of life, bringing in more people to the community, making it an attractive place to live benefits them, as does kind of reducing health disparities and other issues. But then it's also, part of their role as an anchor institution in this community and just as a healthcare organization and their values to really help improve their community. And so it's just been I think they've just done an incredible job. Currently, their big focus is workforce development. I'm sort of pairing people with the jobs that Toledo needs. And they've done a lot. They did incredible work kind of mining the data to really understand what those key sectors are that are shorted on workers and how they can bring together different, educational institutions and other groups and to help train the people to fill those jobs. So it's really, really great work. And then the last example here, San Diego County, California. Like I said, the county is divided into 6 regions, supervisory regions, and service regions that Health and Human Services operates. And currently the 2 north regions as well as the south region are involved. And the county's Health and Human Service Agency is on a Baldrige journey itself. Also, one of their long-term care facilities is on a Baldrige journey. And so for them, it just made sense, knowing that Baldrige works, to then apply that to the community. And so we started in the South region with them. And the Health and Human Services Agency started an effort about 15 years ago called Building Better Health. And it was really a way of engaging other organizations across the county to help contribute to reducing chronic disease rates in the county, which were quite shocking, frankly. They saw so much success in this kind of collective impact model of bringing people together. They added a component of living safely and of thriving. And the County of San Diego actually adopted Live Well San Diego as its vision of a healthy, safe, and thriving county. So each of these regions has a leadership team of people that come together, and basically these partner organizations that can all articulate how they contribute to this vision and how they're kind of helping the strategic components of, reducing chronic disease and other priorities that they've identified. And so they basically adopted the Communities of Excellence framework because they were doing good work. They were coming together. They were, making impact, but they knew that they could do so much more. And so the framework really helped them kind of organize and just kind of take that next step towards excellence in the work that they did. And you can see here, this is kind of an example of their leadership team. Through their Communities of Excellence work, they identified these 3 top priorities collectively. It's a really neat story. I love their strategic planning process. I'll tell it another time. You'll see here that the co-chairs are all from organizations that are not Health and Human Services agencies. So it's really an amazing example of just great cross-sector leadership coming together. And they, using the Communities of Excellence Baldrige process, have identified priorities. They've developed action plans. They have measures, and they're really trying to advance these goals for the county. It's just, it's been a pleasure working with them. So a couple takeaways before I wrap up and just give you time for questions. Some of the things that I think are really important that you maybe heard little pieces of in all of this is it's really important to have clear roles and responsibilities as this, so that people want to help, people want to contribute, but they also need to know what they're, what's expected of them. I think we all feel that way in our work. And the importance of the backbone organization. Somebody has to be driving this work. Somebody has to be making sure that people are doing what they're doing and calling meetings and taking notes and pushing the work along. Adopting a common language is challenging, but I think, as you've heard a couple of times, it's so important to the success of this work. As is what you start seeing, which is this shift in thinking from doing just activities and projects to really thinking long-term about outcomes and how are we going to influence these outcomes, and moving away from silos of working in your own silo to looking at your community as the whole system of people coming together. And I love Kim's example of that breakfast, of people wanting to look at a system, and it starts with like coming together like that. Something really important, this was kind of an insight, kind of an aha for me too, was, when we start a new job, you don't just come in there without training. You have someone that teaches you and coaches you and trains you into that job, and or anything that you do in life. And this is no different. So this kind of work, when we're not used to thinking about community this way and performance this way, and community processes don't exist for the most part. And you can't just bring people in and assume that they're going to understand that or you can't just create a task force and assume that, say go, people are going to just immediately know what to do. We have to teach and coach, and we have to bring people on and continue to teach and coach. And that's what I love about this, the Regional Leadership Collaborative that Crystal's group is doing. And that's what's going to develop kind of long-term leaders with this culture, this belief in, systems, performance, and excellence. So I just think that's so important. And then Baldrige really provides the management model. It provides the roadmap and the framework and the common language. But it's the work of these people coming together and just, aligning towards these goals that just is so powerful and impactful. So really quickly, and then I'll just open the rest of it for Q&A. I just wanted you all to know we're now in our, I think, 5th year of our National Learning Collaborative, and we've had an amazing 5 years as we build up this organization and learn so much from our communities. And we're always trying to listen and provide feedback and support. And we have a new 5-year plan coming out. And we're really committed to investing in supporting communities in the best way we possibly can. And so some of the things that that means is investing in more high quality training, support, and curriculum, becoming a resource of data, and really helping communities be able to identify those key measures and help with that tricky thing of just data in general, and how to do it and what to use and how to make decisions with it. It's so important. Leveraging technology to connect communities, developing a more engaging platform to promote cross-community learning and sharing, and then becoming a research and evaluation hub so that we really can identify and share those promising practices that communities are developing, that are just incredible. So with that, thank you so much for listening to me. I want to spend the rest of the time here with any questions that you all have. And I see one in the chat box here from Ron. Is there an example of an integrated plan aligning healthcare, education, government, and any key businesses? Yes, wrapping my brain across 22 communities to try to give you a specific. I would say that that is the goal of every single community eventually. I would say that they're in different levels of that. For instance, I think what I described to you was San Diego South region, and you saw kind of their leadership team, their advisory committee, and those 3 task forces. They have a pretty incredible plan. They have representation from a lot of different sectors, and I think that's what they're working towards. Similarly, I would say Toledo. One of the things that I didn't mention here is that they have a pretty diverse kind of representation of different organizations across Toledo, the city government, the YMCA, United Way, the ProMedica, a few others I can't think of. And they have developed a set of strategies. And one of the things that they've done now is that ProMedica has actually adopted the Communities of Excellence priorities and integrated those into their strategic plan, as has the city of Toledo. As has another regional, I can't remember what the agency is. So it's not just the Communities of Excellence priorities, but it's those individual organizations and businesses also adopting those priorities, which I think is really, really powerful too. Does anyone else want to add to that, Crystal or Kim or Brenda? Crystal, you're muted.
I think only that in many cases, your leadership group, your steering committee, Ron, includes representation from healthcare and education and government and key businesses. And through that, work at identifying issues and then seeing and convening groups working on those issues, which may or may not include their own organization, but they're having input, they're hearing from each of those groups, and they have input into the priorities and the work that's moving forward. So it's really an overall general knowledge of the key issues and how they can support that from all the different areas.
Exactly. Yeah, I was just going to add that it's also, whatever priority is chosen and sort of put in the middle of that table with all of those different perspectives, whatever gets worked on automatically has all of that cross-referencing going on, right? Because it's that recognition that everything is interconnected. I also wanted to just address another question that I saw here, which has to do with diversity, and that's that a lot of the community excellence groups tend to reflect also the diversity of that particular community. So we see that there are many different people with many different cultural backgrounds and, race, age, religion, all of that, all of those different types of diversity characteristics are certainly reflected in a lot of these community excellence groups. And if they're not in the real core group, they certainly are in a lot of the action teams or committees or other groups that are included in the initiative. So the answer to that question is absolutely yes.
Thanks, Crystal. Yeah, and hi, Wendell. Great to see you. And I would add to your question too that I think, there's always room for improvement, but I think that one of the things about the criteria is the criteria has a lot of places where they specifically ask, who is represented in your community excellence group, and how are you ensuring diversity of viewpoints and diversity in different ways and inclusiveness. And so the criteria itself also makes sure that you're thinking about that. And you'll see, for instance, I think both in Kim's group, they have an ethics and inclusiveness task force, and Toledo also has one. And the role of that is to basically make sure that this work that they're doing is done through a lens of inclusiveness, that they're looking for equitable results, that they have a diversity of people and perspectives involved too. So absolutely would be my answer as well. Thank you. Let's see, Jeffrey, have you ever dealt with a group of school districts and a campus compact with a focus on high schools and colleges with a goal of better student success as a community of excellence? Not specifically, no. The Delaware group is focused on literacy, and they're looking at literacy across a number of different kind of avenues. Adult literacy, digital literacy, a number of different things, but I don't think that we ever have. Let's see. Question, this is from Steve. Can you give one example of an early benefit that arose from a COE effort that persuaded a community to stick with it? That's a good one. I like that. Yes. I'll give one example. It was in San Diego. And traditionally, that leadership group I talked about started out really focused on health. Most of the representation in the leadership team was in health. As they did their strategic planning process, educational and kind of economic challenges really rose to the top as being key priorities. And so they developed the Economic Vitality Task Force, which had a lot of new organizations in it. So they really had to go out and recruit them. And a lot of them were sort of unsure about how they fit into this group, because they're saying, you know, isn't this kind of a healthcare group? And we were really trying to get this message across that, no, this is really about this whole community. So that task force came together, and they decided to do they looked at sort of the data of the South region and focused on and underemployed youth. They found there was just, you know, there are a lot of youth graduating and not as many job opportunities, and there sort of was a disparity in training opportunities for them. So they developed a internship for under and unemployed youth in the South region. And it was a huge success. They put together this internship. There's about 20 or so young people involved without spending an additional cent. There was a lot of time, a lot of, you know, kind of resources donated. But they developed this internship. They put these young people through it. There's some incredible stories. And I remember them kind of talking about it afterwards. And it really, it's sort of, it almost, to me, this is my perspective of it, it sort of just changed the feeling of their group, because they now saw all these interconnections between all of their work and the cross-threading that started going on, and how connected everything was. And I think it really vitalized the whole group of kind of the potential of what they could do together. So Steve, I hope that's a good answer for you. Thanks everyone for your nice comments on here. I will be sharing the slides with you and the recording. Is there anything I missed in the questions with 2 minutes to go?
You might have answered this one, but just in case, I don't want to miss the one about having educators come together and multiple levels of the education system coming together. We've definitely had that happen in Northwest Missouri, and it's been a real interesting you know, exercise in working with those educators. They bring so much wealth and knowledge to the conversation. And just to kind of close us out, we just got to celebrate in one of our small communities the opening of an actual retail store in a small downtown that is a collaborative project between our school district, K-12, extension, which is an extension of the university system, and our community excellence group, partnering together to make sure that our kids could really have an opportunity to learn real life skills and prepare for the workforce. And that never would have happened if it weren't for this sort of effort, bringing those people together. So
thanks, Crystal. I also realized, Steve, I responded to the wrong question. I think I had my rose colored glasses. What do you call that? Like, he said, fail to stick with it. And I was like, no, everyone's great. So I'm sorry. Yes, there are communities like that. And I would honestly say leadership turnover is probably one of the biggest challenges. And that's why it's so important to develop succession planning. And COVID was a really big disruptor that made this challenging in a lot of ways. So I'm sorry that I missed that the first time. So I guess I'm just gonna end this now and say thank you so much for joining us. Thank you to Brenda, Kim, and Crystal, who are just amazing to work with. I hope you will consider joining us for the next year's cohort. And if you have any questions, here is my information, my email, my phone number, and our website. So you can just find me anywhere you want. So again, thank you so much for joining us. I hope to talk with you all soon. Bye.